Hey guys, so I'm going to be doing my social issue presentation over Planned Parenthood funding. So, if you don't already know what Planned Parenthood is or what they offer, um, Planned Parenthood provides reproductive and healthcare services to women who either don't have insurance or can't afford public health care. Some of the services that they offer is STD treatment and testing, breast and cervical cancer screenings, birth control, and they also give referrals for ongoing treatment if that's needed. And Planned Parenthood gets their funding from Title X, and Title X is basically a designed program to provide individuals with family planning and related preventative health care services. All the people who are either uninsured or can't afford those services on their own. So last year in 2021, the Defund Planned Parenthood Act of 2021 was a bill that was introduced and passed in the House of Congress to prevent Planned Parenthood funding. Under this bill, they said that they wouldn't provide funding under Title X to Planned Parenthood no more if they continued to offer abortions. And so a lot of clinics closed, not just because of the reason that they would, it was kind of a big thing in certain states. So a lot of Planned Parenthood shut down under that act. So the reason why I think Planned Parenthood shouldn't be defunded is because they do more than offer just abortion services, and it's a thing that I think is really stigmatized. So there's been a lot of research since some of these clinics closed on how closing these Planned Parenthoods affected those areas. In Texas alone, there was a 27% increase in birth of women who were formerly using contraceptives. So there's not an exact reason as to why those numbers went up so high, but it is kind of due to the fact that maybe the women who were relying on Planned Parenthood for these contraceptives can no longer afford it or get it on their own. And also, pregnancy-related deaths doubled, and that reason is not also known either. But with taking away women's rights and those services to get an abortion, it could have led to more at-home abortions and then potential complications. So those numbers are kind of really big. And there's also been a bunch of STD issues arising in all these defunded areas. So in Wisconsin, chlamydia and gonorrhea infections increased greatly, and former patients of those Planned Parenthood clinics in that area couldn't get in to see doctors at regular community health clinics because of how long the wait times were. Another issue that kind of made really big numbers was the HIV outbreak in Indiana. The Planned Parenthood in that area was the only one that offered HIV testing and, contraceptives, all of that. So those numbers alone show how much more Planned Parenthood actually did for those areas and, just abortion services. So cutting the Planned Parenthood funding really does more harm than good. So Planned Parenthood centers go above and beyond to provide convenient and comprehensive care. They lead the country with up-to-date medical standards and guidelines for reproductive health care. They have a lot of really good programs on educating young women, how to take care of themselves, how to protect themselves, and does a lot to really make all these services little to no cost. And a lot of them offer same day appointments, so you don't have to wait. They have extended hours, and so you don't have to wait as long as you would for a public health center. Um, all those complications and problems and numbers that were rising because of the defunded areas of Planned Parenthood could have all been avoided if Planned Parenthood was still open. So I think personally, there's a lot of things people can do. A lot of people automatically think that Planned Parenthood just offers abortion services, or they really stigmatize the whole thing and correlate those two together. But I think it's important for people to educate themselves, vote, advocate. This is a really big clinic, and I think they do a lot for women, especially those who are uninsured and have little to no access to these services otherwise. It's a big debate and about whether people could just go other places, but these other places don't provide as good of services as Planned Parenthood does. It's Planned Parenthood's mission to ensure that women's access is a full range of reproductive